Pump it up, pump it up.
It's the day with
This is the day to gain inspiration, to make a positive change in the nation. We're inviting you to partake in conversation, to raise your vibration. It's the day that we will all celebrate all of our peace that make this thing elevate. Watch the negative fade away, cause it's the day with Trae.
Grand evening, everyone. Welcome to the Day with Trae. I am your host, Trae Holiday, and we are bringing you another Day with Trae Evening Special. This evening, we have the pleasure of an intergenerational conversation about Washington Cares Fund. Now, this is going to be a phenomenal evening because you're going to learn from three different perspectives about how important this fund is when we're talking about a significant program that Washington State is trailblazing with this amazing fund, from three different folks in different age ranges about elder care and long-term care. So really excited to have y'all joining me. But before I get into it with my guests, it's time for me to get into it with you. This is the time where you get to share this show with folks who you feel could benefit from the daily dose of dopeness we work to give you here on the Day with Trae. And if you can't watch this special, you can also listen to this special anywhere you find your favorite podcast. Just search Converge Media Network and the Day with Trae, y'all, and you will find us there. Now, I'm super stoked because it's not often that I get to bring three phenomenal guests to join me to talk about something that really matters to everyone. And tonight I have some phenomenal folks with me. So come on, join me in welcoming Arianne, Miss Pamela, and Miss Mary.
Thank you.
I want to thank all of y'all for being here with me because you all represent some different perspectives. I want to start with you, Miss Mary, about Washington Cares Fund, known as WA Cares Fund. Tell us more about what this program means to folks.
Yes, thank you. And thank you for having us. We are so excited to be here. The WA Cares Fund is a first in the nation public long-term care fund. Now, what does that mean? It's a benefit that will help to provide support with activities of daily living. So if you think of bathing, medication reminders, and some home modification needs. So that's it, like in a tight nutshell. It's a benefit to help us when we find ourselves in situations where we need hands-on support to maintain the quality of our lives.
It's really beautiful to me to hear that Washington is kind of setting a model for the rest of the nation to follow. With this being new, there's a lot of things that we're going to learn over time, right, in terms of the implementation. But I'll come to you, Ms. Pam. Tell us a bit about what you understand about this program, because it provides a certain amount of funding, right, to do those activities. Tell us more about those details.
Yes, well, right now the benefits that it provides is about $36,500, and that benefit is very helpful to people who may need it in the future. I work with a lot of elderly people in long-term care, and I notice how people would feel that Medicare or Medicaid will supplement what they need. In actuality, Medicare does not cover long-term care. It has some great benefits, but it doesn't cover long-term care. And you really have to know the laws for Medicaid, because there's spin downs and there's a lot of hoops and you have to jump through to get to Medicaid. So with this benefit, it's definitely a good avenue to use if needed. And I feel that me being close to an age where I'm going to need it very soon, I really support the program, the benefit.
Yeah, absolutely. I mean, plus your expertise in working with folks who need it. I know for me, my family, we just came across, my grandmother had a stroke. We came across the need, right? Because she was in a nursing facility and we're like, okay, she can't be there forever, right? And it was supposed to be rehabilitation, but it was so new to the family. Mm-hmm. And so Arianne, I want to talk to you about, as a young person, how do you see this shaping up and allowing you to maybe help elders in your family now and then eventually for yourself?
Mm-hmm. Yeah, I haven't thought about it until I was introduced to my project during my internship. But I know that in my family, we're expected to take care of our elders. My mom, she's getting up there in age, and I'm still a full-time college student, and I have a part-time job. So I think that Washington Cares is going to be really helpful for me and my family, just because we are expected to give back. And I don't have a problem with that, but I do know that, like, financially, I want to be secure. I want to be financially secure when the time comes to give back to my mom and then my grandparents, because they're also up there in age.
Yeah,
Yeah.
and that's such a great response, because in many of our cultures, we have to be there for our elders and our loved ones. Mary, when you think about how the planning for someone like yourself, what this looks like and how this helps you, tell us more about how you personally could benefit from walk cares.
Yes. So, I'm 54, right? And I'm nearing retirement. I can retire. And through my life, I've never really thought about long term care insurance, right? I think most people make sure we have health insurance in place, we make sure we have car insurance. But this is an area where, myself, I really never thought about, like, if I had an accident and was still like functionally able to, like, I'm not in a facility, I'm at home, but like I can't get up to fix my own meals, right? So um, I haven't done that planning. And the data shows that only a third of people in Washington prior to this benefit had long term care insurance, right? So that shows that a lot of us are more focused on our day to day, right? Taking care of our kids, taking care of, right? You mentioned your grandmother. We're focused on the immediate need. And when a situation happens and now we're thrust into trying to figure out what medically is going on with ourselves or a loved one, and now trying to figure out, how do I alter my life to be able to be there for my grandmother, or who's going to be there for myself? And as Arianne described, like, she wants to be there, but realistically, financially, what would that mean? So I think the comfort that I have with this program is just being reassured to know that the state has been progressive enough to think about um, the 2/3 of Washingtonians that haven't thought about it, or maybe don't even have the means to have the extra coverage in place. So for me, it provides a real reassurance that if something happens to me, that my children won't have to drastically alter their lives, right?
Yeah.
They're in their late 20s, right? I want them to be able to continue on with what they're working on and not completely stop to be able to take care of me. And just like Arianne, right? We have those same cultural values, and they would want to do that. But as a mother, I also don't want to be that heavy of a burden on my children. So this benefit gives me some ease and reassurance that we'll be able to work together with a family plan, and having those conversations now about, okay, we have this plan, all three of us, because we're all working, we're all paying into it. And so now, what can that look like so that it's more of a balance, instead of, you're having to stop and have like years of your life where your goals or dreams may have to be put on the back burner, because of course you care for your loved one, and of course you want to do everything to make sure that they have what they need. But this gives me, and I think everybody, just a little bit of reassurance, knowing that our state cared enough for us to put something in place to make sure that we can have just some options to help support us.
Yeah, well, I'll say it says a lot, honestly, because you're talking about 2/3 of folks not being prepared. And oftentimes these plans are overlooked. Let's just be real, right? We get health care for our immediate needs and what we need now. Some folks have insurance plans for like a death benefit. so that families are covered when they do pass on. But we often don't think about that in the middle place.
Right.
And long-term care really is that in the middle place, right? Where you, like you said, it could be a lot of different things. And sometimes like people need to understand it's not just about when you're older.
Exactly.
Because again, if you find yourself in the situation with an accident or anything else, and now you need that additional assistance throughout the day just to do the things that are normal to so many of us in our everyday lives, that's real. One thing I'll also say about this too is while we have the, cultural tradition and a lot of ethnicities and kind of backgrounds are wanting to care for elders, we also aren't trained in it.
Right.
We're not trained, right? I mean, we're talking about needing help with going to the bathroom and bathing and Pam, in your expertise, tell us a bit about what this now means for folks to be able to get that additional care for the expenses that come with long-term care.
Absolutely. Right now, I'm currently dealing with a brother he's 62 years old, and he has frontal lobal dementia, and the care needs is extremely expensive. He has exhausted his savings account, and my brother is a veteran. So even with the veterans benefit, as well as maybe the pension you might have, it's great to have it, but this benefit here, the Y Cares benefit, will offset those costs. And so right now, my sister and I are like juggling being caregivers. I'm a caregiver from afar because my family lives in Chicago. But it's just the fact that we're really juggling with this, and it shows how important the Y Care funds is. Washington is the first to implement this, and I hope that other states see us as a trailblazer and just come on and hop on with it, because I feel right now juggling between how to get a caregiver, how to pay for transportation, it's just so many different avenues that we're putting in place to try to help my brother, and he still wants to live independently alone. So that's another thing we're trying to keep him aging in place. And this service, this benefit that we have is truly, truly would be a help if it was, needed to others. I also, I work in long-term care. I work with long-term care facilities, people who have loved ones in the long-term care facilities. It costs about $300 to $400 a day for that. This benefit will help offset those costs as well. So it's really, really important. And family members going into long-term care facilities not knowing how to pay because they're under facilities are giving them the contingency of, if you pay privately for so many months, then we can start trying to get Medicare or other benefits to kick in. This Y Cares benefit will help with that offset of the cost with paying that private pay.
That's a really great point, because I think a lot of people don't understand what happens if you don't already have Medicare, or you don't qualify for Medicaid or something like that. There's an interim period that people are not aware of until, again, they're faced with it, right? I know there's some elders in community. I've seen this happen. And then even with my own grandmother, I'm grateful that she was double covered, right? Because then she was able to smoothly transition from the hospital to the rehabilitation place to where she is now, which is a 24-hour home where she has that care. But we're just grateful that we found the right place for her. Because I also know too, a lot of these facilities that have 24-hour nurses, they're really expensive. And it is a financial responsibility that a lot of families are not able to meet. And so that interim period, like you talked about, of private pay until another benefit kicks in, this Y Cares Fund coming in the middle there is super important, because a lot of times that's where families have a huge financial burden, honestly, right? If you're not prepared for it, then it can mean a lot. Arianne, when you hear all of this, right, and you think about, okay, I'm a young person, I'm just trying to get myself financially secure, thinking about your grandparents and your parents, you said your mom, how excited are you that they will have something additional to support them if and when that time comes?
I'm actually really excited that something like Washington Cares happened when as I'm entering, like the workforce. I didn't realize until I started working like a lot of taxes, they kind of come out of my paycheck, but I don't really see this as one. It's really more for me and for my family, whoever needs it. And then, I do a different kind of caretaking. I work at a daycare with kids, and even that gets expensive. Like childcare is very expensive, and so I think being able to like contribute, even if it's just small amounts to this fund, it helps me feel like super secure in not just my future, but also my mom, my grandparents, and then my future children.
Yeah, absolutely. I think about, this fund doing what it's meant to do and how many people it's going to be able to support. And you mentioned learning about this kind of through your internship.
So I started my internship July, and it was supposed to end August, that second week of August 15, but I didn't get a project introduced to me until maybe that last week of July. And so part of it was promoting Washington Cares and like including like all ages. And so I chose to do kind of like a film, and I chose to produce a film that had caretakers. A lot of them were men. I had to ask a lot of people, but a lot of people that said yes, they were all men, and they were all like different ages. And I think it went to show that caretaking is not just, like a woman's job. When you think of caretaker, you think of like a mom or a grandparent or like a grandma, but it really applies to everybody. And so when I learned about it, it was just kind of like really eye-opening for me, because I didn't think about caretaking until I learned about Washington Cares. And specifically, they asked us a hypothetical, like what happens if overnight you or someone in your family needs long-term care? Who do you go to financially? Who do you go to for help? The only place I would know for sure was my savings. And even then, it's definitely not enough to keep providing for myself or for someone who's taking care of me.
This can help to break down that myth about caretaking, right? And we talked about this. I mean, families step up, right? Mary, you were talking about not wanting to be that burden. How do you see this program informing your children now about the opportunities that they have to utilize this in case you're needing that support?
Thank you for that question. So this program has actually sparked the conversation, right? My son is working, and Arianne, you're working, so you're paying into the tax, you're paying into the benefit, right? And so having those conversations of like, do you know what this is? Do you know what this will provide? And talking through like different scenarios that have happened in our lives that could have resulted in needing long-term care. So I think that's the most beneficial thing, is it's sparking the conversations. It's getting our communities to actually now start thinking about what would that look like, instead of being found in a situation where we're reactive, right? And so, like for me, I had surgery on my foot, and I didn't need long-term care, but for that short time, that 8 weeks that I was out, it really came close for me, like really thinking about, what if this was going to last longer than 8 weeks, right? Trying to navigate on my non-dominant foot, trying to balance to do just like brushing your teeth, and couldn't put any weight on it at all. That was a challenge. And so with this benefit now, it's really sparking people. So the conversations with my children are, let's talk about this, right? They like riding four-wheelers and activities, and and so it's like, well, what happens if you were to go down, right? I'm your mom, right? We have a family network. We'll be here to support. But this benefit will also help with that. And as I'm aging, right, and have a granddaughter, and looking at wanting to make sure that she also is able to have a good, full quality of life. So I think that the most important thing is that it's sparking the conversations in families. And so that's why this piece, like this intergenerational piece, I think is so important because it touches us at all aspects of our life. Like you said, it's just not for when you're aging, right? Young people have accidents or have health situations every day where they end up in situations where now their lives have been changed forever. Right? And so these conversations we need to continue to have. We need to continue to think about, like, our homes, right? Like, what changes would need to happen to our homes, right? Do you have 13 stairs to get up to your bedroom, right? Or are you living on a one-level house where it would be an easy transition if you found yourself needing mobility assistance?
This is really bringing up so much for me, because I'm telling y'all, you don't understand until you're there. So it feels like this is such a breakthrough for so many families, for really everyone, because honestly, you need to have those conversations now so that you can be preparing for whatever may come. But then also you think about the inevitable. That is the cycle of life, right? Like, we always talk about, newborns and babies being, so connected to elder care, right? The care part is real. So I love this name, Washington Cares. I think it's so significant, because anytime you're doing this level of care, you got to come from a place of care. And that was one of the things that we really looked for in those who were caring for my grandmother, right? I mean, anytime you have, someone who has lived in your household, now has to be in a facility, there's a lot that shifts in the mindset there. And so, Pamela, you were talking about you and your sister, trying to juggle this. And sometimes it may only fall on one person in the family, right? Sometimes you have a lot of family members who have full-time jobs and no one can really do it. And so when we think about this fund being able to be utilized for those who don't have, loved ones that can care for them, who are needing to tap into this fund to really utilize the money to support them in that way. Tell us about how that's impactful too, for those that don't even have a family member who can step up.
Absolutely. It's a resource, it's just something that people who don't have family members to go and help advocate for them, and they have to advocate for themselves. They know that they have this benefit to help with medications or transportation, Meals on Wheels, community activities such as adult daycare and things like that. They can fall back on our, Mary said, just someone to come in and help them with their activities of daily living, just cooking or washing dishes and things like that. It's extremely important. And even I just want to piggyback on those, the caregivers, the stress, the amount of stress that will decrease from just knowing that there's an extra benefit to help. They can step back and get some respite care while another person comes in and help with their loved one. I notice a lot of times when family members are dealing with caregivers, being at that caregiver, that stress level is so high, it becomes sometimes abusive. So I feel this benefit is definitely needed to help alleviate some of that stress that family members are getting. Not only that, the individual themselves, high level of suicide among older adults, that can also be a little decreased and eliminated, hopefully. But I feel that, I'm very strong with the WAD care. I feel this benefit is extremely helpful for individuals who don't have loved ones, and for individuals who do have loved ones. I too had a conversation with my daughter, and she lives here with me. She is very upset about the income that's being taken out of her her paycheck. And I had to, let's be real. I'm like, if something happens to me, wouldn't you be happy that you are contributing to something that will help with you take care of me? And she never thought about it like that. She was like, oh yeah, she was only thinking about it won't help her. And I'm like, you never know. You never know you have an accident or you should fall down the stairs or something. The benefit will help us all.
Yeah.
And so after I educated her, I even called my son who lives in Chicago, and I'm like, let me give you this scenario. And he was like, yeah, that benefit is very good because I would need it to help you. And I was so happy that he said that, so I know who to go to.
There you go. These conversations are important, right? And I really appreciate how you said this is opening up the conversation. Yeah. I always think about the things that we do not discuss that you don't even think about until it seems like it's too late, right? And the preparation is so important. As a young person, I'm like, oh no, I don't want none of this money coming out my check. I don't need that. I don't need this. Mm-hmm. But you're so right when you say that this is why having the conversation and the education around long-term care is so important, because it can help everyone. We have to really get out of this myth that this is only for those elders.
Right. Yeah.
And even so, how are we caring for elders, right? Yeah. And so I think about both. I was just having a discussion the other day about how, as a young person, there was an elder in my neighborhood, just right around the corner from me. Somehow we came across each other's paths. These little cats, these kittens, would be at her porch all the time. And so she told me like a story about the neighborhood and, the history of the Central District. And it just intrigued me. But she didn't have any loved ones. She was there kind of by herself. She had a caregiver that would come every day. And I just started going over there. And I was like a teenager. And I didn't realize then that like my draw to elders and the wisdom they carry and the stories that they have when they are not able to share them with loved ones, when loved ones are like, I'm too busy, grandma, grandpa, I don't got time. I'm out here living my life, right? Yes. And I think about that now with my own grandmother and how special it is to learn from them. And so this idea that this is not only for them, this is for anyone who needs long-term care is essential. Tell us a bit about, how that impacts you and maybe some of the conversations you either have already had or maybe will have with your grandparents and your mom.
I haven't had a conversation with like the older people in my family. I've had that conversation with my brother. He, I told him I had been working on the Washington Cares project. It was a fund. And then, I said tax, and then it just something in his, it just like clicked. And then he goes, so they're taking it out of, my money, my pockets. And I had to explain, it's not going towards anything else. It's for you. And then he was kind of just, he wasn't for it. It was a tax. He made up his mind. And I had to remind him that he was on bed rest. My mom was caring for him. Washington Cares wasn't around at that time. And I had to remind him, it's not just for when you're older. It's not just for our mom, our grandparents. It's also for us, because we can plan all we want, but it's never really going to go our way. And so I saw Washington Cares as like a financial security for when something like that happens. He kind of got it because he was thinking about like exempting from it, and I had to tell him not the best idea, because like someone our age, we don't have much in our savings. Savings is really low right now, and we're like, he's paying rent, that's like $2,000 plus. And so I had to explain that this is something you're gonna need in the future, whether it's far or you never know how soon it's coming.
So I'm glad you were able to have that conversation, because you're absolutely right. The more that we can be intentional, I think this is a big step for Washington State to say, let's be intentional about what this looks like. Let's not leave it up to individuals to say, oh, no, not for me, not for me. You don't know. And there comes a time where if you live long enough, this benefit is going to benefit you, right? Yes. Like that's really the truth here. y'all are talking about having these conversations now, and it needs to become a part of general discourse, right? Like really it does. You know, I have had many conversations, especially after my grandmother had that stroke, y'all. And I'm telling you, it changes the perspective you have.
Right.
Because we didn't know that that was going to happen to her, right? We're like, she's been healthy. You know, we know her a couple of issues. They're being managed. You know, everything is okay.
Right.
She was able to live with my parents for the last like 27 years, or probably more than that, maybe 30 years. And the beauty of that was that my mom always says, I told your dad, we're going to have to care for her. And my mom was the youngest of 6, right?
Right.
But she knew from an early age that like, hey, when it comes down to it, I'm going to have to be there for my mom. Now, at first, that was just a space. It was you just having a room, you know, because she was mobile. She could do all these things. More and more and more, other things began to creep in. Okay, now we got to make your meals. Okay, now you got to have somebody coming in because I still got to go to work. And, you know, we need somebody here with you half the day just to make sure you're good, taking you to your appointments and things like that. But it increases over time. And so I love that you were able to have that conversation with your brother, you also, y'all with your children, because this is something that is going to benefit us all, but already is now. If we have a greater understanding of why we're pouring into the fund and how to access the funds, which is where I want to go next here, Miss Mary, because that is where I think a lot of folks sometimes get stumped, you know, right? Do you know much about the accessing of the fund? Let's say you come in contact with that need. Now I've been paying into it. How do folks access it?
Great question. So first, July of 2023, we all started paying into the fund. And July of 2026 is when we will be able to access the fund, right? And so the state has been working very hard and with the area agencies on aging to help figure out like how do we stand up a program, have contractors in place, have a seamless program so that when July 2026 comes around and people are ready and need to access the benefit, that it can be as seamless as possible. So wallcares.org is the website. And I encourage people to start going onto the website now. And you can see some stories of different situations of people speaking about how the fund can benefit them. There's a nice roadmap to help people to understand how the fund works. But essentially, you'll be able to complete an application online. There will also be a call center set up to be available to help people walk through what's your situation, what services are available, and putting together that package of service to meet your need. Now, so the area agencies on aging, so I'm the director for Seattle King County, and we will also, all of the AAAs will play a role in really with our communities of color, right? Where English is not a primary language, or we just have a fear of interacting with government type agencies, right? We have been in the communities for here in Seattle, over 51 years. Right. And so we have those connections, we have those relationships, and we're available to help people who maybe they're not comfortable with filling out an application online. They'll be able to fill out a paper application, and we'll be able to hold their hand and walk them through like, what does this look like and how do I access the benefit? And then that brings for me also, you know, if you Google any industry, right, and you look and see who is harmed the most, pick any industry, right? Healthcare, education, criminal justice, across the board, it's people of color that we are always harmed the most. So being here, and thank you so much for opening your doors to us, because we really want to make sure that we're not only getting to all generations, our youth, but also our communities of color, right? To let them know you're paying into this and you have a right to this benefit. And when we pull the data, once we're able to access the benefit, it is our goal and hope that the numbers will show that communities of color are accessing the benefit at the same rate as our white counterparts, right? And we're not being left out on a benefit that we're paying into.
But I want to say that you're absolutely right. And it brings me to the next point I really wanted to make here, which is this fund is leveling the playing field.
You are a working adult, regardless if you're a citizen or not. You are working and paying into this fund. You will be able to access those benefits. And that's so important as because we're dealing with people that are just trying to do the best to provide for their families and are, trying to figure out their citizenship concerns, right? And all that comes with that, right? But this is being set up to where you're paying into it, you'll be able to access it. And I think that that is such a beautiful thing that Washington State has had the foresight to be able to set this up in a way to make sure that our community members, right, that are facing additional barriers, right, trying to be intentional, as you said, about making sure that those barriers are not in this benefit.
Yeah.
And so, it really is. And then, the power of our youth, I'm just so excited that Arianne is having those conversations in her generation. This young generation they're so powerful and they're smart, they're intelligent, and they have, I think, just different relationships and different capacity than what we have. Yeah. So that's so good to see that, like she's able to talk to her brother and be like, hey, you need to understand this. And to get him to see that, okay, you're right, I do need to, get on board with this. So that is just a beautiful thing.
This is why I was so excited to have all of you join me today. We could have had this conversation with maybe just Mary, but to have all of you here is so powerful. When you talk about Washington leading, it really gets me excited to be a Washingtonian, to be honest, because this is a program that is like no other. Right. We're talking about incorporating those regardless of citizenship, which is huge.
Right.
Regardless of your financial status, of how you've been treated throughout your lifetime. I think about elders in the Black community who have told me just some of the most horrific stories about what they have had to encounter, and to know that this program levels the playing field for everyone so that people can get what they need, y'all. Yes. Come on, that's something to celebrate for sure. It really is. I'm going to give y'all opportunities to give last words. I'm going to start with you, Arianne. Tell us last words about this program that you want the folks out there to know.
I'd say specifically to the folks, in my age group, don't exempt. Like, I can speak comfortably. Like, I'm pretty sure, my savings is not where I want it to be if I had to take care of somebody or myself. And so I would say, just putting into this fund, keeping it for yourself, and, it's just a safety net for you and your family. It's not something that you should be missing out on when you don't have to.
Yeah.
So, yeah.
That's a great message. Thank you for sharing that. Yeah.
Well, just me working in long-term care facilities and listening to family members about the cost and everything, and, knowing that the government programs that we have, Medicaid and Medicare, they have stipulations, and this benefit doesn't. I feel that this is a wonderful benefit where it will help offset costs for people who are living in those in long-term care facilities, and I think it will definitely decrease the stress for the loved ones who are trying to help their loved one, their family members to as they navigate to help their loved ones in the system. I also feel that it's very, very important because I myself am getting older. I would tell my age, but I'll be 60 in February. And so I'm truly, truly thinking about this long-term care benefit. A lot of people, such as myself, never thought about it until Washington Care was initiated, and I had to think about, how am I going to take care of myself? And yeah, I could be driving and get into an accident. I could fall down the stairs. I need to start thinking about myself. Putting in power of attorneys and doable power of attorneys, that's all important, but having a benefit that's going to allow you to age in place is even more important. So I feel that I'm very, very happy that we are the trailblazers of this, and I am too proud to be a Washingtonian.
Yeah, that's a great word right there. Thank you. Yay.
Thank you. So I also just want to highlight, so for someone that's making about $50,000 a year, you will pay approximately just over like $8,000 over 10 years to be fully vested into the benefit, right? And that gives you access to $36,500 of benefit. It will increase with inflation, but I just wanted for people just to understand just the perspective of what you're contributing versus the benefit that you will receive, right? And it's not something it's an extra thing that you have to do. It's already happening for everyone, regardless of age, regardless of status. If you're working, you're paying into it. So even working part-time, you're paying into it. And so that puts you in to be able to access the benefit in 2026.
Mm-hmm.
The other thing that I wanted to highlight is just to make sure that you're doing your own research and education, right? WildCares has a wonderful website set up with a lot of information and encouraging people to have the conversations with your family members before you need it, right? And because it is real, right? And we didn't talk much about people developing health situations, right? That could lead you to needing long-term care. So, so that's, also very important. It's just having the conversations, start thinking about planning, start thinking about, like, what are some of the other things along with Wild Cares that you may need to put into place for consideration. And I also just want to say that, I work for the city of Seattle in the Human Services Department, and we have divisions that really serve our community. So our YFE, our Youth and Family Empowerment Division, has the internships with our young people that come in and they work alongside of us, and they do wonderful projects, as Arianne mentioned. Our Safe and Thriving Communities, that's really out in the community helping people that are really struggling from crisis situations. And it's a wonderful team that is just heartfelt and heart-led. And then we have a division that works with homelessness, right? And really helping people that are unhoused and unsheltered and dealing with public health crisis. And then we have our division, Aging and Disability Services, right? Which also is the area agency on aging for not just Seattle, but all of King County, right? And we are providing that direct service case management work for our older adults and individuals with disabilities, and we bounce between first and second in the nation with leading, with helping people to age with grace and dignity in their homes. So we definitely are connected in the community, and we see what the quality of life looks like for people without benefits, right? Being forced into institutional care versus it's an option that may be exercised or not. So I'm just really excited and just so appreciative of you having us here today. And just again, want to thank Pamela and Arianne for helping to make this intergenerational conversation happen, and your wonderful, fantastic facilitation skills. And we just appreciate you so much.
Y'all, this has really been a pleasure for me. I'll tell you, personal experience cannot, there's nothing that can replace it. It cannot be replaced. All of my family members have now had a direct experience in my grandmother's experience. And that says something.
And I am a long-term care ombudsman, and for people like your grandmother that lives in the facility, we are trying to make sure, advocate for people who take that benefit, WAD care benefit, that it's going to be, it's not going to take away their right as well. So we're definitely going to be advocating for that.
You know, this
for
is
the benefit.
This is important. You're absolutely right, because does one benefit trump another, right? If you have these other benefits, how are you getting access to this other one? I mean, these are those things that now we have the opportunity to learn about. You gave us the website, wadcares.org.
Yes.
I want to encourage everyone to go there. You know, I want to thank you all, because you could have been somewhere else today. You could have chosen not to dive into this topic, or to give your personal experiences and anecdotes, which are so helpful for people to understand how these conversations are developing in our families, in our friend groups, right? But it's important for us to be able to carry that torch forward and really normalize these conversations so that people are understanding what they're paying into now, how to access it, how to get the information, and how to get prepared when it comes to long-term care. Thank you all so much.
Thank you.
Thank you.
Wow. We are talking about a fund that is the first of its kind in the nation. Yes, we're paying into it, but all of us will be able to access it. As I said, it really levels the playing field here. We have so many different things that show us an unlevel playing field. Am I right? We talk about it on the Day with Trae often, and definitely Converge Media is here to uplift the ways that solutions are being rooted in our communities to level playing fields in all types of ways. But the WAD Cares Fund is one that is doing that for all of us. This is something that is really unprecedented. All of us need to understand what this fund is, how we can utilize it when the time comes, and how we can prepare ourselves properly. Because I'll tell you right now, one thing you don't want is for you to need something and not be prepared. This is the time to learn. Take these next couple years we got to educate yourselves. Understand the different scenarios in which you would be able to use this fund and access this fund. Go to wadcares.org today. Learn more. Find your way to get engaged. And I want to thank all of the folks who were involved in making this real, because you're showing how Washington State is stepping in to be a part of the solution. And y'all know I'm always inspired when we can share and uplift and amplify solutions that are happening right here in our backyard. Washington State is doing something big, and I'm glad that we were able to take some time this evening to share it with you all. Now you're informed, and the ball is in your court. Make sure you get educated. Share this information with others who you know have jobs and they're paying into this. Let them know that there's a way to get educated about how to access this fund when the time comes, so we can all be under WA Cares. Thanks so much for watching today, y'all. And you know, I'm always appreciative when you spend the evening with me. Share this with those who you know need this information. And I look forward to bringing you another Day with Trae Evening Special very soon. Converge Media produces culturally relevant content for Black and urban audiences. Our coverage is raw, transparent, and objective, praised by community leaders, government officials, and residents. Support Converge Media today via Venmo, Cash App, or PayPal at Converge Media.